Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why.
Good evening, everyone. I'm so happy to be here in North Florida today. It was relatively good weather day. We get a little rain over my neck of the woods overnight, so the rain was gone by the time I got up this morning. But otherwise, the temperature was pretty decent today. Not too hot, not too cold. Joining me with this evening is the behind the scenes guy, Mr. Tyrone Jackson, that we call the Fix It Man. You know, he changes his name every week. But how you doing, Tyrone?
I'm doing well, Doc. I'm doing well.
Well, good. Happy to hear that. And we're going to have joining with us again, Mr. Jerry Urso, with the James Weldon Johnson branch of Asala. Did I pronounce that right?
Yes, you did.
All right. With Asala, we've had Jerry on this on our show before because he's such a great historian. And tonight I'm of particular interest because he's going to help guide me through some of our history in healthcare as it relates to African Americans. And Jerry, that is pretty much what we are looking at this evening.
Yes, it is. We're going to talk about healthcare from Spanish Florida to the Spanish flu of 1918.
Okay, very good. And of course, Jerry is our beloved historian because he's teaching me stuff, especially with the healthcare. He's going to teach me stuff. Well, he's always teaching stuff I didn't know. That's why we bring him here so he can educate us on just this same subject matter. It's not a whole lot of questions that I'm gonna have, except when, as the subject matter comes up, I'm gonna ask Jerry to help me understand some of what he's referring to. Jerry is taking the time out. Mr. Urso, sorry about that. Mr. Urso is taking his time out to put together something for our audience that can be very informative. Actually, probably throughout the United States, not just here in North Florida or in Florida, but throughout the U.S. It brings us up to speed with a lot of what we're looking at and have been through in our time, that we're in a time where they don't want us to discuss Black history. Okay, we have got to go out and learn and teach our kids a lot of this on our own, and that's why Mr. Urso is so important these days in terms of helping us bring the truth to matter.
Awesome.
So
yeah, it's always a pleasure to have Jerry on. The depth of his knowledge and the subjects that he cover or have been powerful, and I look forward to the same thing today. It's just enlightening and exciting just to have him on. So Jerry, thank you once again for coming forth and bringing the powerful wealth of knowledge that you give to us.
Well, I get to show my bias because I love the First Coast. So I want to have a football team called, the First Coast History, something where I can wear a shirt and hat and show my bias every day because, the history of the First Coast, it doesn't matter if it's medical profession, the legal profession, civil rights, you can always find some foundational people and events that started here on the First Coast.
Yeah, and that's where you have truly amazed me, in that, especially the role that Jacksonville has played, Northeast Florida has played, not just state-wise, but nationally. And, very, very enlightening to me because I had no clue as it relates to that. For the fans of Miss Turner, she's going to be joining us a little late this evening. So you just have to put up with us guys for right now, but she'll be joining us soon.
Yes, yes. And one of the things I wanted to say, and I think about when we have Jerry on, and I hope it's okay if I call you Jerry.
Yes, please.
Though it is how well society has done its job of keeping the information from us.
Exactly.
That is one of the things I leave the show thinking about when we have Jerry on. The information that he brings up and the fact that it's happening right here in our own backyard and we have not heard about it. It's a testament to first his willingness and ability to research and bring the information forward, but it's also a realization that we have to truly understand that it has been a lifelong mission to suppress this information so that we are unaware.
Well, as they say, history tends to repeat itself. And so just like they tried to quell the knowledge and quell the input that Black America has put into this country and made this country, quote unquote, great, not again, great in the beginning, the efforts that they put into it, people like Jerry can help us diffuse that effort because, you know, I'm still trying to catch up from where my childhood was. All they talked about was Christopher Columbus, you know, which is ridiculous. But again, that's water under the bridge at this point. That's because, you know, we got people like Jerry. I can't think anybody else like Jerry, but we have Jerry to help enlighten us.
Well,
what the truth of the matter is.
Let me say this, Dr. Kane. There is a lot of good coming out of their efforts to suppress history. There are more people taking an interest in the history and exposing it. And now that we have the internet and social media, we have, you know, bloggers and vloggers that you can't, it can't be kept down anymore. So people are going to search for it and they are going to find it. The only bad thing is you have some people that are very uneducated and make it up as they go along.
Exactly.
I'll give you a real quick case in point. It started about 15 years ago. I thought it went away, and now it's back about John Hanson being the first Black president. And I'm like, he was a slaveholder from a slave state representing the interests of slavery of Maryland in the Constitutional Convention.
Right. Okay.
The camera hadn't even been invented for another 60 years, but they have a photograph of John Hanson. and for me, you know, like the woman I talk about first tonight, she's the person we should be talking about. We should be talking about Joseph E. Lee and Josiah T. Walls, people that have done so much in history that aren't known, but we're going to make up fake figures.
Well, and one of the things I am seeing these days, and I've seen, or at least I've seen on several posts, whether it's Facebook or others, where some of the Black churches are beginning to take on the responsibility of trying to teach history. The only thing I'd like for them to do is to find a historian such as yourself, Mr. Urso, to be sure that they are getting the information as correct as possible.
They're doing a really Donica Toa, Enos Davis, here in Jacksonville. They are amazing historians. It's a privilege for me to work with them. Jack's Today, Jack Cities, Modern Cities. Every single week they're putting out information, so it's out there.
Excellent.
Yeah,
excellent.
But the task and the challenge ahead is, how many years does it take to unwind the hundreds of years of misinformation?
As many as it takes.
I know as many as it takes, but I'm just saying. So the effort has to not only be there today, but it has to be consistent. It has to be given in a method that has a plan so that it continues on and just doesn't wane over the next few years.
Or until the next broadcast. We just, next podcast.
Right.
We want to just kind of keep it moving.
But there's we'll go right into it. But I'll just say there's 1,000 books on Abraham Lincoln. There's 1,000 books on George Washington. I enjoy finding people that aren't no books written about that deserve them.
Yes.
And so in some ways I feel like I just feel like an archaeologist in Great Egypt, and I'm discovering these great tombs of former people who lived these amazing lives, and somehow through the passage of time and suppression, they've been lost to history. And there's nothing gives me joy than when I call a Donica or Enos and I discover something new, and I can't wait to tell them about it.
What we may need to do is have the three of you guys get on here and start, I guess, I don't want to say rambling on, but start a discussion that we can be participatory in terms of listening to what you guys go through in order to obtain this information, as well as how you validate it and so on and so on. So I think that represents a possibility for a future show. If we can do as we do with cats, we can herd all y'all together at one point in time, that would be great.
Absolutely.
Okay, so without further ado, I think I don't want to hold you up anymore, Mr. Urso. Let's go ahead and get started, because you're the guy that can talk about this. All I can do is look in amazement and ask questions.
Well, tonight's show, I really hope you and Jocelyn get to interject when I discuss certain facts from different periods of time and different people. So because I'm a historian, not a medical researcher, so you'll be able to give me some clarity as we go.
Maybe, but again, they kept a lot of that from us in terms of even the healthcare professionals being able to discover and learn the truth about some of this info. So without further ado, let's get started. And good evening, Adonica. She wrote in the comment section, good evening, everyone. Greetings, everyone. So, Mr. Urso, take it away.
Okay, Tyrone. So tonight we're going to discuss African-American healthcare from the Spanish Florida to the Spanish flu. And over this 350-year roughly history, I really hope that we can unlock a lot of the history that's suppressed. So we will start with the next slide. And this is Maria. She is the first nurse in American history. So she is a slave in St. Augustine. And according to Spanish rule, if you convert to Catholicism, and if you're a man, fight for the crown, or if you're a woman, leave your service to the crown, you are emancipated. Now, I have not located any manumission papers on her, but we did locate her marriage certificate to a man named Simon. So while she's enslaved, she is a nurse at the Santa Barbara Hospital, which is the first hospital on the continental United States. She is helping the Spanish soldiers. She's helping the native indigenous people, and she's helping enslaved people. So she, at one point, the governor of the state of Florida, he writes to the Spanish crown, okay, and his name was Gonzalo Mendez de Canso. And he writes to the Spanish crown, and he argued that Maria was so indispensable to the hospital's operations that he requested that the king provide a formal salary for her labor, a rare acknowledgement for the professional value of a slave woman at the time. So, but she is the first nurse in American history as a Black woman.
Excellent.
So we'll go to the next slide. So now we're going to be discussing the enslaved midwives. And so when discussing, they were the keepers of life and memory. They were holding life in their hands while enslaved. And in some aspects, the birth canal was an assembly line. So if something went wrong at birth, and with all the technology we have today, children still die at birth. And the amount of pressure that the granny midwife was under, because if something went wrong or she was delivering a white baby and it died, she could be punished or put to death. And if the black baby died, it was a product. It wasn't a human being to these people. It was a product. It was, it was a replacement.
Yeah, it's like currency, right?
Correct. But they were very highly respected and also, when they were sold, it would say that they were a midwife, or if they were auctioned, it would also say that they were midwives. So they had a certain intrinsic value to the slave trade that went on within the United States.
But Jerry, just real quick, when people talk about midwife these days, they automatically have this picture, and no disrespect to anybody, but automatically has this picture of a Caucasian woman as being the first midwife, or the lead, taking the lead in providing midwife services. So here's the definite correction, and that not being a truth.
I mean, we'll take a short detour for a second.
Okay.
The enslaved that were brought to Florida were brought from specific places in Africa for certain reasons, right? We know that on the coastal regions, people were brought because of their ingenuity when it comes to irrigation, especially for plants, right, and for crops. We know that in the rice paddies that there were enslaved Africans that brought that knowledge of agriculture when it comes to rice farming to the Americas. And what gets little acknowledgement is the highly advanced forms of medicine. We know that a lot of the herbal drinks and roots and all that, we call, holistic medicine today,
yes,
they brought with them. Okay.
Yes.
And we know that all the way up until the early 1900s, they were doing forms of bloodletting. People, we lost 2 presidents, not because they were assassinated because of the assassin's bullet, but because the way the doctors treated them. Right. And an infection and so forth. So the knowledge that the enslaved brought had a profound effect on the medical industry. So, they were using cotton root, pennyroyal. They were making teas and so forth to induce labor. They had a high advanced knowledge of vegetation in Florida. They were able to assimilate this information and able to make these herbal remedies long before they were pharmaceuticals. So they were highly, highly intelligent, highly advanced. I think, one of the things that people think because someone can't read or write is a lack of intelligence. Mm-hmm. If you were denied the right to a formal education, but you were able to compensate in other areas, shows that how intelligent you really are.
Yeah, with 40 years of, I call it 40 years of being somewhat able to advance in this society and not having the boot on our neck as bad as it was pre-civil rights, we overcame, 400 years of suppression to such a great degree. I think that the current society is afraid of us because we advanced so far in just 40 years of having just a fair opportunity, somewhat fair opportunity. I'm not going to say completely, but somewhat fair opportunity at expressing the level of our intelligence. But I digress. Jerry, one quick minute. Ms. Turner, happy you can join us.
Good
How
evening.
are you this evening?
I apologize for my tardiness, but when I got on, I was just all into the discussion. I was like, wow, looks like I'm missing out on something. So go ahead. I'll just get in where I fit in.
Well, that's what I told Jerry about me earlier. So go ahead, Mr. Urso.
Okay, next slide. No, one after that, because I discussed that. Okay.
Let me, before you move past this, Jerry, that last one, if you can go back to that, Tyrone, I'm reminded one of my friends always, not that one, the one with the plants and stuff. I have a couple of friends who swear by the roots, the root barks and things like that in terms of medicinal purposes. As a matter of fact, I got a recipe from someone the other day, and I went to the grocery store today and got the thing. So I got to make a batch, y'all, and I'll tell you, when I go to the doctor in about 3 months, we'll see if it's made a difference. But one of my friends used it and says that they feel amazing. Yeah. Okay. I just had to mention that after seeing that slide. Go ahead.
Go to the next slide. So here's just some examples of the of a slave auction receipt I found. They're actually on the bill of sale. Says that the woman that was being sold, who was nameless, was $850, but it lists her as a midwife. And one of the auctions is that a Negro woman named Betty, she can cook, and a midwife and the mother of 3. Even though with the horrors of what was going on, we do have to acknowledge that these midwives were highly sought and equally dangerous position that they were in. Like I said earlier, in some ways during chattel slavery, the birth canal is an assembly line. And so they're holding not only life in their hand, but to the enslaver, it is a financial burden to lose a child at birth, and they were whipped and beaten and sometimes killed if they lost a child during childbirth. And when you're having breaches and so forth that they have, we have all this technology today to if there is a breach or a child is misdirection in the canal, that they can correct it ahead of time. The midwife doesn't know until
time of presentation.
Exactly, time of presentation.
Right. And what I am looking at when I look at this, $850, and just imagine, and you have to imagine, what is that like worth? I mean, that kind of value today, I'm gonna say 1,000-fold.
Like a Lincoln Continental, I saw another one was, I think, $2,000 for a healthy male between 18 and 25 was $2,000, which is the equivalent to a new Mercedes-Benz today. Yeah.
And this, well, again, $850 for the services that she could provide. I mean, just imagine. That's a lot of money in today's time. Hell, if I can get the same amount for 1 year's work, I think I'll retire tomorrow.
Well, that's roughly, I did it real quick. So that's roughly about $35,000
in today's monies.
In today's money.
And what year is this, Jerry?
This was around the 1850s.
Yeah, that's what I put in, 1850. So equivalent for $850 for 1857 was about $34,500.
So what
would still a lot of money.
What would 2,000 be?
What would 2,000 be?
Yeah, that would be about 70,000, 80,000, right?
Probably close to 100. Well, double
79,000, so about 80,000.
Yeah.
So
okay.
If you didn't get the whole Mercedes, you get a good portion of it.
So, Jerry, when you were talking about that, if during birth, if a child did not make it, that the midwife could be killed, does that mean if it were a black baby versus a white baby, she was killed if it were a white baby, right?
Historians say, well, that would only happen if it was a white baby. But I'm like, if you have a finance, and I hate talking about it in these terms because it just disturbs my soul. But from a financial perspective, the baby is a product, and it costs, and what the baby's value would be, $30,000 or whatever at some point in its life, they would be beaten.
At a minimum.
At a minimum.
Yeah, at a minimum, they would be beaten. I think it would depend on how many they had available.
Right.
Oh, you mean a replacement as far as the midwife?
Right. You can't. If you don't have a replacement, then you have to seek other cruelty.
And not kill them.
Like we got all this discussion of, you noticed the last few months, people talking about slavery around the world and so forth. There was no institution of slavery that was more brutal than the chattel system in America.
Absolutely.
Let's just tell the truth and stop saying, well, they did it too. No, it's
they're quick to say that. Yeah, they're quick to say that.
Okay,
go ahead, Jerry. I'm sorry for
no problem. Next slide. So while Harriet Tubman, she joined the 1st South Carolina Volunteers. One of John Brown's secret sis was Thomas Wentworth Higginson. So Harriet Tubman was a nurse and a spy for the 1st South Carolina, which later became the 33rd United States Colored Infantry. While she was at Fort Clinch, there was a large breakout of give me a second. Let's I'm having one of them words. Dysentery. Okay. Right. And so while they were having this dysentery, she went out into the woods and she made some water lily and some crane's bill. And, she made these teas and it worked. She saved a lot of lives while she was at Fort Clinch. As a matter of fact, I don't know who it was, but someone actually tried to patent her remedy that she used at Fort Clinch. So she was healing soldiers. She's going on spy missions. But, we talk about the amount of enslaved people that Harriet Tubman freed. But at the top of the list was her vast knowledge of holistic natural medicine.
Never knew.
I never knew she was a nurse.
Yes. So I gave her, since I'm a historian, right? Other people get to name people. I call her the hero of the march.
Absolutely.
She was so much, and I actually have newspaper documentation from the Civil War period of Harriet Tubman and using these particular remedies. Next slide. This is Susie King Taylor. Susie King Taylor is the first official African-American nurse for the United States military. She's she joined the 1st South Carolina also, and then she provided care to the wounded and sick soldiers in the Union camp. She got to work with Dr. Seth Rogers. Seth Rogers was actually an abolitionist himself. So he was a Harvard graduate from Harvard Medical School. He was probably one of the most advanced surgeons in the entire United States Army. Probably could have got Lincoln to give him any position he wanted, but he wanted to join the experimental unit called the 1st South Carolina Volunteers, which was a Black infantry unit led by Thomas Higginson. So she actually learns from the best. Okay. Mm-hmm. And so while she's there, not only she was in Fernandina, she was Fort Clinch, she comes to Jacksonville and the Sea Island camps. She later in life writes a book, Army Life as a Black Nurse, because she was denied her pension. So she wrote this biography of her experiences later on. Matter of fact, she writes a letter to Captain Towbridge, and he writes her back that how upset he was that she never got her rightful pension. And in the letter he writes back to her, he says, I can think of no one in the service of the United States Union Army more deserving than you. Also, while she's there, she's teaching the soldiers how to read and write. So she's helping them write letters home. When letters come back, she's interpreting them for them. And one of the most famous people she taught to read is Thomas Long, Thomas Warren Long, I think I talked about him on another show. He was the former slave that became a senator and also became superintendent of the Department of Education.
Wow.
So her life is a testament to medicine and education. Okay, next slide. So here, what we find is the yellow fever epidemic. So what is the yellow fever? It was a viral disease spread by mosquitoes. The cause was not understood in the 1880s. So let me tell you some of the insane, and when I tell you insane ways they tried to combat it. So they would burn fires all around the city of Jacksonville to purify the air. Then they brought in cannons and fired them in the streets, thinking that was they literally fired cannons in Jacksonville, thinking that the smoke and so forth was going to kill the mosquitoes. They would eat some people. So if a whole family had the yellow fever, in some cases, in order to combat it, they would burn the entire dwelling down with all the people's belongings in it. Some of the steamers would come up on the St. Johns River, and when the wind was right, they would try to blow smoke into the city of Jacksonville. People were blamed because they thought it was a contact sickness. Entire communities were shut down for months. Residents fled cities to large numbers. And so they took all these desperate measures because they didn't understand the science of viral diseases at the time and the causes, which was a mosquito. Next slide. So here we have one of my, so how did this epidemic change Florida? Well, they did a lot of quarantining. Masks were used. They were forced masks. So Dr. Joseph Porter actually becomes the first state health officer. So this crisis actually creates the Department of Public Health. So with all that devastation and losses, this actually changes the landscape for the good. So one of the bad things is that people died during the epidemic. One of the good things is that at least the state of Florida, the government decided to create these boards of health at the time, which would be later, every city has one. So they started sanitation programs, disinfection programs, disease surveillance, and so forth. So this is, the grassroots of what is now known as the Florida Department of Health.
And as an employee, we learned that during my 36 years with the department. We learned about the history and the State Board of Health, as a lot of people called it in 1982 when I came to the health department.
And there was some forward thinking back then. It looked like we're doing retro thinking right about now because of the dissolution of what they may still have the so-called health department or Department of Health locally, but they don't take on the responsibilities, in my opinion, and I think more than just me, don't take on the responsibilities that the original Department of Health took on and especially through the 60s, where it was a place that provided reliable, as much as we knew at that time, reliable access to medical care, especially for those underserved areas.
But I remember what they talked about. I'm sorry, Jerry.
No.
I remember
during that time, it says over 10,000 residents left Jacksonville.
The mayor of Jacksonville fled to Savannah. Some of the white doctors fled, and you're going to see in the next slide in the next few slides, how Meharry and Howard University medical schools impacted medicine in the state of Florida.
Okay.
Dr. King, when you were talking, I was thinking about your comment. I'm also reminded how the nurses used to tell me how they used to work out of their cars, going out in communities, doing public health nursing back in the day.
And not be paid for.
Well, they didn't say that part. They may not have gotten paid a lot, but
Well,
were
it's not a
they were
conviction.
employees at the time, so
I took a women's history class at Harvard University last year, and the Deltas in Florida would work out of the trunks of their car and do testing throughout the state in the 1920s and 1930s.
Wow. More power to the Deltas. I got a lot of AKA friends that might want to hit me, but they can't through the podcast. Go ahead.
So if you're just tuning in to Pause for the Truth tonight, we're talking about the legacy of Black healthcare pioneers in Jacksonville and beyond, really. And with us, we have historian Jerry Urso, who does an amazing job. And he is a member of the James Weldon Johnson branch of ASALA. So hit him up, because I tell you, this guy is a walking encyclopedia about history. Go ahead, Jerry. I can't wait to see the rest of your slides.
Okay, next slide. So this is Dr. Alexander Hanson Darns. I had the privilege of, so I wrote an article about him about 7 years ago. My mentor tipped off someone at the Smithsonian about my work, and they sent a reporter down, and with Russell Alexander were Alexander Russell, which is his great nephew. They actually featured some of my research and the family history of Dr. Darns in Smithsonian magazine. So one of my proudest moments.
Awesome.
So he
was enslaved around 1840. His mother is Violet Pickney. His exact father is unknown. I can with confidence say that he is either the half brother or first cousin of General Kirby Smith of the Civil War. So if y'all remember Kirby Smith High School. So if you ever see a picture of Kirby Smith and Alexander Darns, the forehead gives it away. But as a 14, so Alex actually travels to Mexico during the Mexican-American War with Kirby Smith. So he works in a medical tent. So, and then during the Civil War, he is forced to, he works for a medical unit for the Confederate Army under General Kirby Smith. Kirby Smith is also the last Confederate general to surrender 3 months after Lee's surrender of Appomattox. So, he grew up in St. Augustine. Now, the Kirby Smith family, the Segee Smith household is actually split. Some of the members actually fight for the Union Army. So Kirby Smith's sister lives in Connecticut. Her husband is a Union officer. After he's emancipated, they pay for him to go to Lincoln University, where he graduates from the top of Lincoln University, graduates from the top of his class. He ends up going to Howard University and graduates the top of his class. I think he's in the top 10 of his class, where in medical. So when he comes to Florida, he moves to Jacksonville and opens up an office. In James Weldon Johnson's book, Along the Way, there are two really profound statements that James Weldon Johnson talks about his early influences. One, as we've talked about before, is Judge Lee, where James Johnson, his father, who was the pastor of Shiloh Baptist at the time, takes James and John Roseman Johnson to Judge Lee's court because they wanted him to see what an influential and powerful Black man is under authority. They also sweep the floors of Dr. Darns' office, and he actually teaches them how to fish. And James Weldon Johnson mentions that in his book, that they used to go fishing with Dr. Darns. So the next slide, please. So during the yellow fever epidemic, he is one of the premier doctors treating people for this disease. And so he had advanced knowledge of epidemics and so forth. So he remained in Jacksonville and choosing duty over danger. alongside with Dr. Lemuel W. Livingston and Public Health Director William Middleton Ottrell, who was the principal of Stanton High School, would stay and take care of the sick. Over 4,500 people ended up being infected, more than 450. So almost 10% of the people that got the yellow fever died. Dr. Johns treated the poor, the white, black, or the forgotten with skill, compassion, and courage. He advocated for clean streets. He advocated for proper waste removal, safe drinking water. So these things were not really talked about in 1888. To give you a case in point, so when President James Garfield was shot, a black attendant doctor was the first on the scene. A white doctor, now he was a Howard graduate. A white doctor took over and put his dirty hands in his wounds from the get-go. He died of sepsis. He died of infection. Most scholars today said that if they didn't do anything, he probably could have lived. But because of not sanitizing and so forth, putting your dirty hands in a bullet wound, he died. So, a lot of these Howard and Meharry medical doctors were practicing this sanitize your tools and washing your hands before treating people. So they people got to remember George Washington, when he was sick, they were cutting him and bleeding him, thinking that the bad blood would come out, when all they were doing is weakening the immune system. So,
absolutely.
So yeah, Dr. Darns, when he dies, the Jacksonville Journal called it the largest funeral in Jacksonville's history. It took place at historic Mount Zion, and they said half the people attending were white and half the people were black, that it was so crowded that they had someone standing on the front steps repeating the sermon to the people that couldn't get inside.
Wow.
So the next slide, this is William Middleton Ottrell, who was an educator. He actually starts the Frederick Douglass School in Key West, Florida. He is a good Templar. So he was a member of these temperance societies along with Ada Braddock and Judge Joseph E. Lee. So they were preaching to the prostitutes over on Houston Street, where they had all the bordellos. There was an opioid epidemic in Jacksonville. It was called laudanum at the time. They were advocating for people to not drink, not drug, not gamble. All the vices that come along and separate people from their independence, financial independence, any success they have, gambling. So, he was a very pious man, but at the same time, he was a highly educated man. He's the second principal of Stanton High School. He's actually the principal while James Weldon Johnson is there. And during the yellow fever epidemic, the mayor of Jacksonville appoints him the director of public health. And he is also advocating for the same things, clean the streets, sanitation, garbage pickup, so many things that we know today are dangers to public health. And they were wild. If you think about it, in the 1880s, this is a wild idea. So, I mean, when you think about what was it, the Dark Ages, was caused by rats.
Right.
So
the plague.
Yeah, the plague in Europe, they caused the Dark Ages. I mean, medical science has really been asleep for a long time. And it was, conventional medical science, I should say. But a lot of these formerly enslaved people they got this naturally from where they grew up by osmosis. This is how you grew up.
They knew exactly. Now, I want to go back to something you said, though, the first opioid epidemic. I'm going to call it the first opioid.
I was wondering, too. What was it called?
It was called laudanum. So if you ever watch a cowboy movie, did anybody see the movie? Did anybody see the movie Wyatt Earp?
Yes.
Okay. Yeah. Do you remember his
Doc
wife?
Holliday?
Yep. Doc Holliday.
No, not Doc. Wyatt Earp's wife. If you remember, she was strung out, and she was always trying to get a bottle of laudanum for someone. They would, for rheumatism, for headaches, and so forth. It was straight up opium.
Well, you remember they had real cocaine in Coca-Cola in the early 1900s. That didn't get out of the Coca-Cola till I think maybe 1920s or something like that.
Yeah, and they used to come in cans and they called it snuff.
Yeah.
So drug addiction. Ben Franklin was addicted to cocaine.
Yeah.
So there's nothing new under the sun. But if you think about it, when you have someone that grew up in a household of a herbalistic medicine, then they go to college and get a formal education on in medicine, that they are able to do what doctors are just finally coming around to do, where they're combining holistic and conventional medicine, because for years, the medical field shunned upon holistic medicine.
Right.
So now you're seeing a lot of cancer research hospitals and so forth. They're combining conventional medicine and holistic medicine. So we're getting back to, like I said, Meharry and Howard University, these doctors understood both.
Exactly. That's something I want to kind of get our audience and truth be told, our medical community back into entertainment of both, not giving up on stuff. We do know that people that are in certain positions that you can't go out and experiment on them with a holistic medicine, knowing what you know about this, I'm gonna call it carbon-based medicine that we have today. But there's nothing wrong with trying to matriculate through both to the best benefit of the patient, not the benefit of big pharma.
Okay, next slide. This is Dr. Douglas Watson Only. He is a businessman from Jacksonville. His family owned the first steam-powered planing mill in Florida. So planing is when they take the rough wood and it's cut into dimensional sizes. The planing could smooth out the surfaces to be sold. So he uses enterprise as a vehicle for community reliance, economic independence, and protection during one of the city's deadliest crises. He maintained workforce, mostly Black workers, providing a stable industrial employment, a leader in the building trade, supply materials, and advanced technologies through efficiency of steam powered and so forth. He also was a medical doctor and surgeon. He actually, the whole Only family, they actually had a dentist's office across from the Masonic Temple on Broad Street as one time. They had, so they were working with the Freedmen's Bureau, the Colored Auxiliary Bureau. He negotiated with the Board of Health to remove Black inmates from Liberty Street jail, where they were getting higher rates of mortality from the yellow fever. So he actually advocated for the prisoners at the time during the yellow fever epidemic. He was a very important person in that way. He also had a butcher shop, the Only house. He also had a boarding house. So he used his wealth, and you see this repeating theme on any time I come on when you during the Reconstruction period, where we're talking about Clara White, Eartha White, the Onlys, Dr. Darns, A.L. Lewis, and so forth. There was such a responsibility that came with success. And you find that the most successful and richest people in the Black communities were giving back tenfold, 20fold.
I like what you have of the industry. What he said, industry was my instrument. The welfare of my people was my purpose.
Excellent.
Yeah, that's pretty awesome.
But they all had the same mindset. When we talk, I don't know if I mentioned it on the last show, but you had 6 major Black insurance companies. You had North Carolina, you had Atlanta Life, you had Central Life, Citizens Life, Union Life, and Afro Mutual. They all became very successful and very wealthy. But if you look on Emancipation Day programs, public health programs, when they were building Edward Waters College, Cookman Institute, Bethune-Cookman, FAMU, it's the same names working together to raise money. So they're competitors by day, and in the evening, they're allies for the cause of their people. So we'll go to the next slide. So let's talk about health and mortality differences in the 1900. The average white male lived to 47 years. The average black male, 32.5 years, and black females, 35 years. So in the inner cities, black children were 36.2%, to white children at 21% of infant mortality rates. So I'm working on a project with Enos Davis on the Mount Herman Cemetery. So I've been going through obituary records, newspaper articles, and there were so many infants that are buried in Mount Herman Cemetery during that 1880 to 1920, in the 40-year span that Mount Herman Cemetery was in use. And you see so many 12, 14 years dying of consumption, which we call tuberculosis today.
Yeah.
But you can see it played out in this cemetery, the infant mortality rates in Jacksonville with the black community.
Sadly, when you look at the life expectancy gap, black men still live younger, or die younger rather, than any other race. Yeah. And one interesting fact that I learned is it didn't even matter if a woman, generally education improves your health, everything about your life, and including health outcome. However, when it came to black women, we were still lower than educated black women was still lower than uneducated white women. I don't know if it still is. I haven't looked at the data lately, but that was just always something interesting to me. And we know that other factors contribute to that.
Industrial risk is another.
Yeah.
So African-American men faced a higher rate of death in the workforce, in the workplace,
Right,
as opposed to white men. So the gap between has always been, 10 to 15 years. And as it plays out, it's almost 15-year difference between a black male in 1900 and a white male in 1900.
one thing you do see, Miss Turner, is that the infant mortality rate, black versus white, doesn't look like it changed much, does it?
Did we lose her?
Nope, sure doesn't. No, I'm still here. No, I agree.
So
well, looks like there have been some gains, because like you said, that's 15 years. Currently, it's only about 8 years or 7 years between black men and white, 67.6 to 74. So
true.
And also nowadays they have it down to the area of town where you live also makes a difference. So, and obviously then we're talking about access to care. And I know that's something that Tyrone, you and Dr. Kane have been talking about, access, how so many providers are moving, with Jacksonville being the largest city in America. And when providers are moving out of neighborhoods and further away, if you don't have a car, or if you don't drive, like most seniors stop driving after a certain point, then access to care becomes an issue all over again. So, by the way, we are 6 minutes before the end of the show. And Jerry, I know you have a lot to unpack, so we can move this along if you'd like.
Yes, boss. So Brewster Hospital
that's where I was born.
So built in 1805 as a private residence, the old Brewster Hospital and Nurse Training School was located in the villa. The hospital opened in 1901 through the efforts of the Women's Home Missionary Society of the Methodist Episcopal Church. Matilda Cutting Brewster of Danielson, Connecticut, donated $1,000 in honor of her late husband, Reverend George A. Brewster, to help start the hospital. It was sponsored by the Boylan Industrial Home and School. One of the little known facts, it was Brewster Hospital, it was the Negro Welfare League and Travelers Aid all coming together to form the Jacksonville Urban League. The hospital grew out of its first facility into a different in La Villa by 1910. By 1931, it was located in a large brick building on North Jefferson Street, the old Sugar Hill neighborhood. With the passage of the 1964 Civil Rights Act, Brewster Hospital closed in 1966 and reopened as the Methodist Hospital. In 2005, Old Brewster Hospital moved to its present location to the original site on West Moan Street to commemorate the historical marker. It was really important that you find that Brewster and then the Clara Fry Hospital in Tampa, you start seeing the addresses need for Black healthcare and have their own facilities. And, one of the, and we'll bring it up now. So people don't realize that people born before the Civil Rights Act passed, especially in rural places in Florida, don't have birth certificates because they were born by midwives. So
I experienced that with my dad. Couldn't get one, and when he got it, it had so many errors on it, and it took an act of Congress, literally. Corrine Brown's office helped me to get him a birth certificate, and it was the first time he had one the last year of his life. Yeah, I want to just ask you a quick question, Jerry. So, was George Brewster or his wife, were they African Americans?
I'm gonna have to. Donica, can she text in? I didn't research that, but I'm sure Donica is going to fix any corrections that I had made during the episode. She's going to let me know later anyway.
Oh, okay. I was just curious.
Tyrone, can you check that for me? I don't think so, but I'll check. So now we're going to go to one of my favorite people. Her name is Jerenia Valentine Dial Reed. Her father is one of the founders of La Villa. His name was Tillman Valentine. He was a sergeant of the 33rd United States Colored Infantry. He's buried at Old City Cemetery. He's one of the carpenters and contractors that built the original structures in La Villa during the Reconstruction period. He is the post commander of the Grand Army of the Republic. During the yellow fever epidemic, she lost a sister to the yellow fever. And at that time, she was working as an assistant to Dr. Alexander Darnes, where she gets her love for medicine. She is the first African-American woman to be a registered nurse in the state of Florida. She graduates on May 4th, 1903. And she's actually one of the among the early professionally trained African-American nurses in the country. She returns to Jacksonville as the first Black registered nurse, provided bedside care. So when Brewster Hospital first opens, she's actually the instructor for the nurse training program that was held at Brewster Hospital. And she, in some ways, she's the mother of Black medicine on the First Coast. Go to the next slide, but during this service in the segregated Jacksonville, she's actually the first African-American women's golf club. So she's also part of that Gilded Age, where she comes from a wealthy family. She married wealthy. She's highly educated. So she's living that gilded life, as they or the bougie life we'll say today. But her connection to Jacksonville, she works around the country in several other hospitals around the country. The Freedmen's Hospital in Washington, D.C., where she trained from 1894 to 1903. Brewster Hospital. So she's gotten around. She was actually an instructor for Bethune-Cookman in Daytona, also is instructor there on the nursing program they had there. So she she's responsible for a lot of women getting their nursing certificates. So next slide is Dr. George P. Norton. He is he's from Alabama. He goes to Meharry University, where he gets his medical degree. He first practices in Hibernia, which is in Clay County. He practices in Appalachia. He's the first Black doctor in Apalachicola, and I think he's the second Black doctor in Tampa. He opens up a chain of drugstores. He owns a lot of land. So during the Spanish-American War, it is George Norton that goes to Cuba with Teddy Roosevelt. So he actually had Teddy Roosevelt to dinner at his house in Tampa. They had become friends. We actually have his shotgun that he brought back from Cuba in my museum. But his son becomes one of the first Black dentists that starts a dentist club that still exists to this day. W.E.B. Du Bois called his son one of the most well-read men in the entire South, who spoke 7 languages. So Dr. Morton, and he was vehemently upset after the death of Booker T. Washington. A lot of people give Booker T. Washington the blame, but he had already died. But during the Tuskegee experiments, he was livid and was writing letters. I got secondhand information from the grandson that's still alive that his grandfather would write letters to Tuskegee talking about don't let them do the Tuskegee experiment. So we'll take that with a grain of salt. Next slide. So Dr. Smart Pope Livingston, yes, that's actually his name. Dr. Smart Pope practiced medicine in Jacksonville. He was a physician in service, surgeon on Davis Street, located in La Villa. He served as the assistant city physician for Black residents, played a key role during the segregation municipal health system, providing medical care and advocating for the needs of Black citizens. He is the founder of a free children's clinic, established a free children's clinic to the undeserved families, provided care for childhood illnesses, preventive services, and health education. One of Jacksonville's earliest community-based pediatric healthcare physicians. He did his training at Cookman Institute, then later Howard University, and then Meharry in Nashville, Tennessee. He actually is one of the co-founders of People's Life Insurance Company. He provided health and burial insurances. He also works with Thomas H.B. Walker and one of the first members of the St. Joseph AIDS Society. And he believed in, through medicine, leadership, and vision, Dr. Pope Livingston helped institutions that uplifted families and transformed the lives of Jacksonville residents. So he is another person, another pioneer that we need to keep his name on a marquee somewhere. Next slide. This guy, when we talk about, wait till you see the next slide and you're going to be amazed. So Dr. Roberts was from St. Augustine. I got to give a shout out to Charles Tingley from the St. Augustine Historical Society that got me a lot of preliminary information that I could write my article and studied Dr. Daniel Webster Roberts. He was born in Indiana, and just after Emancipation Proclamation was signed, he began high school at the age of 21. He worked as a janitor in Chicago to support himself through medical school. He graduated as a physician in 1896 and relocates back to St. Augustine. So he founded the Roberts Sanitarium in St. Augustine, the first Black-owned hospital in St. Augustine in 1896 to 1908. He treated Black and white patients during segregation. And there's another fact, and you can look it up. A lot of the white people, when they got sick, sought out Black doctors. And you have to remember, and until the later boards of health and qualifications and so forth, some doctors in the mid 1800s were apprentices. So some did not go to school, but they inherited the doctor's practice. So by name, they were a doctor, but they didn't have the degrees. So a lot of African-American men that graduated from Howard University and Meharry and other schools around the country were highly trained, highly skilled, and highly sought after. So during the Spanish flu, he traveled by horseback across North Florida, serving patients from Ponte Vedra to Ormond Beach to the First Coast. He had several horses, so he could get across the state quickly. He actually trained a bunch of white doctors on how to treat the Spanish flu epidemic during the Spanish flu epidemic. He was the president of the Florida Medical Association of Colored Physicians, chairman of the board of the St. Augustine Industrial Institute. He was a member of Booker T. Washington's Negro Business League. He was a philanthropist, funded schools and education. He treated hundreds of Floridians during the 1918 influenza epidemic known as the Spanish flu. He shared knowledge with other physicians, and he would turn down no one regardless of race. And according to St. Augustine historian David Nolan, he is remembered he did not lose a single patient during the Spanish flu epidemic. He died in 1919 at the age after 22 years of service in St. Augustine. His funeral was described as one of the largest in St. Augustine for the African Americans. He returns to He was returned back to Indiana for his burial. He's honored at St. Paul AME Church in Lincolnville with a marble baptismal font funded in 1925 by a committee, including former Confederates that he helped save, to fund that fountain at a black church. I'm going to go to the last slide. So let's talk about the Spanish flu. So the early stages of the Spanish flu epidemic, African-American men were 2 times higher, the mortality rate to their white counterparts. As the Spanish flu at its height in 1918, black men were 3 times higher to die, but white men jumped. It was almost 5 times as high at the height. And we think there was several factors to that, how they were treated in close proximity. So, as we know, that was a virus that spread. And this, if you've seen the picture in the top right, everybody was forced to wear masks everywhere you go. They think some of the drivers was overcrowded housing, limited access, poor sanitation conditions, segregation, equality. But, for the most part, African Americans died at a higher rate. But during the height, actually, white men was a 608 to 100,000 for black children, for white children, and I think it was on the country as a whole, it was 1,500 black children to 100,000. So there were regional statistics. So you find rural places in Kentucky, Appalachia, and so forth. Some of the white mortality rates rose above because they were extremely poor, had the same conditions as African American communities in certain areas. But I think this is an opinion, not a fact. I think that the healthcare that's passed on from generation to generation in some of these households probably contributed at the height of the epidemic in some of those communities to account for the differential in mortality rates in some of the instances where whites were had higher death rates. And that is the end of my presentation.
And it says death was the deadliest inequality of 1918.
Yes.
Wow.
Because it was black and poor. So when you look at a lot of the whites, they were in the smallest, smallest regions in the country. The most suburban regions of some of the poorest areas, Mississippi, Alabama, Arkansas. So a lot of those rural communities didn't have any health care either. So, that might have accounted for the disparity in the numbers. Well, and Jerry, I think black doctors had a lot to do with it too. Yeah.
Well, I think you just really touched on the history. I think now that we're in the 1900s, you probably can catch us up on the last
100
That's
years
Adonica's
now.
job.
That was the first, eons ago. So, but as usual, thank you so much. Do you have any final thought that you'd like to leave with our guests? Or is it see you next time, folks? Nothing?
For me?
Yes.
Yeah.
Oh, no,
Final thoughts?
I'm just always glad for you guys to have me back on, allow me a space to pass on what I learned, because I don't want to hold it to myself. This is something I'm passionate about. I enjoy doing the research. I enjoy writing about these individuals, and I enjoy sharing that information.
Thank you so much. Behind the scenes guy, what are your final thoughts tonight?
I'm going to keep it very brief. My final thoughts as I was listening to Jerry, I was thought, wow, why don't we have any streets named after these people in Jacksonville?
Well, SP Livingston Elementary does exist, so it was nice to learn his history. But you're right, I agree.
No streets, okay.
Dr. Kane, what are your final thoughts?
So to answer Tyrone's question, again, we got to bury it. Not we got to, I'm being sarcastic, speaking on behalf of others, but they got to bury the history of our contributions to this country. And regardless of what area of science and technology it is, the history is being buried and it's not being shared correctly as it should be. I do want to make sure that we do bring Jerry and definitely your co-conspirator in this,
Adonica,
in terms of the knowledge that you guys bring us up to speed, especially with from, I think you gave us to maybe about 1920, give or take, the era in which and bring us up to speed from that with what she knows and as it relates to the history of medicine, whether it's in Jacksonville or through the state of Florida, but you guys may be able to speak to both. But I think it would be a very informative program because we still got a few of the guys, one or two still alive today in terms of some of their contribution to, and in particular, I'm speaking of Dr. C.B. McIntosh.
And I mentioned to Jocelyn that I would definitely got to get my wife and my sister-in-law on because their mom was a healthcare pioneer. And what she did and what she was able to accomplish, not only in the military, but as a civilian nurse and to building an institution that's named after her. So
excellent. And I mean, again,
and I won't be on that one. I'll shut up and listen.
Again, we mostly, we're not really applauding the sacrifices that some of these people made, from their own personal lives. As you say, as you mentioned about one of the healthcare officers that ran away from the battlefront, these guys stayed on the front line, not just stayed behind the scene. They stayed and really helped allow the Black community to survive, however be it may, to survive an era in time which could have wiped us out.
If you get a chance, please look up on YouTube James Garfield assassination and type in the bad health care he got. And it was actually a Black physician that was trying to save his life, but the white physician took control of the entire scene. And it took the man, I think it was like 45 days to die. And he died one of the most horrible deaths of infection. And he's president of the United States. But it just show you the insane methods that they were still using at that time to heal people.
And well,
Jerry, thank you so much. Thank you so much, Jerry. We've gone a little bit over, but as we come to the close of tonight's episode, I hope this conversation has given you a deeper appreciation for the legacy of Black healthcare in Jacksonville and beyond, a legacy built on courage, compassion, and community. What we've heard tonight reminds us that while history may reflect struggle and inequity, it also reveals strength, innovation, and the power of people coming together to take care of one another. The stories of institutions like Brewster Hospital and the many unsung heroes behind them are not just history, they are part of a living legacy that continues to influence how we approach health and wellness today. And of course, at Pause for the Truth, we believe that understanding our past is essential to building a healthier, more informed future. And that future requires all of us, community leaders, healthcare professionals, families, and individuals to stay engaged, ask questions, and advocate for better. I want to thank our guest, Jerry Urso, for sharing his knowledge and helping bring these important stories to light. And thank you to our audience for tuning in and being part of this ongoing conversation. And of course, to Adonica in the background who's chiming in, making sure, filling in the gaps for us. Until next time, take care of yourselves and each other. And remember to always pause for the truth.
We appreciate you spending time with us on Pause for the Truth. Ms. Jocelyn Turner and Dr. Rogers Kane are grateful for your support. Don't forget to like us on Facebook, catch us live on Twitch, and most importantly, subscribe on YouTube. A big shout out to Tyrone Jackson at Call Tyrone IT Services for keeping us connected. Join us every Tuesday at 6:30 p.m. Eastern Standard Time for more enlightening discussions. Thanks, and see you next week.